Hello. It's Dr. Melva. Had some technical difficulties. Come in. You know me, I'm Dr. Melva, your board certified radiation oncologist. Broadcasting live today. Come on in. We'll get started in just a few minutes. Welcome. Hello, come on in. Wait for everyone to come into the broadcast. How's everybody doing today? Broadcasting live from Chesapeake, Virginia. Come on in. You know me, I'm Dr. Melva, your board certified radiation oncologist. Today is Thursday, August the 3rd, and it is 6:30 p.m. I'm learning the new Facebook Live changed a little bit, so learning it a little bit here. All right, welcome to the broadcast. Say hello so I can know who's here. Welcome. Please share the broadcast. Sharing is caring. I'm Dr. Melva. Today we are going to be talking about the follow-up visit. Join me today as we talk about the follow-up visit. We'll be getting started in just about a minute. All right. Hi, Deborah. Welcome. How are you doing today, Deborah? Thanks for joining the broadcast. Thanks for joining the live broadcast. Please share. Sharing is caring. For those of you just joining, I'm Dr. Melva. We'll get started in just a few minutes. I'm excited about what we have to share today, talking about the follow-up visit. Looking at my lighting, it looks a little dark where I am. So can you see me okay, Deborah? Let me know. I can't really see it. All right, come on into the broadcast. We'll be starting in just a few minutes. I'm Dr. Melva. Please share the broadcast with others. Tell everybody to come on in. Yes, I'm good. Thanks so much, Deborah. Okay. I'm like, I can't tell if you can see me. So, all right. So we'll go ahead and get started. You know me. I'm Dr. Melva, your board certified radiation oncologist. And I help people that have been diagnosed with cancer through my community cancer centers, speaking, and programs. They will learn to take charge of their lives, navigate the cancer care system, and live in spite of the diagnosis of cancer. So today, thank you for joining me, August 3rd, 2017. Can you believe it? 6:30 p.m. I'm broadcasting live from my home, and I'm in Chesapeake, Virginia today. And we are going to be talking about the follow-up. Okay, welcome to the broadcast. Please come on in. I'm Dr. Melva, and today we're talking about the follow-up. So I would like to give you 3 reasons to look forward to the follow-up. Welcome to the broadcast, Tiffany. Thanks for joining. Please share. Sharing is caring. So the follow-up visit. I like to focus on the follow-up visit because if anyone has read Dr. Covey's book, The 7 Habits of Highly Effective People. There we go. The 7 Habits of Highly Effective People. One that has always stuck in my mind is to begin with the end in mind. Okay? So we're going to begin with the end in mind. And I like to think about that during your treatments as the follow-up visit. Okay? Because at the follow-up visit, 3 things are going to happen. So let's take you undergoing a course of radiation treatment, for example. Okay? So when you're undergoing a radiation treatment, you may get side effects. Let's focus on one of the most common side effects, which is an advanced skin side effect. Okay? Called moist desquamation. Has anyone ever heard of moist desquamation? An easier way to say that is an open ulcer. I should have pictures to show you. Sometimes this can happen toward the end of your radiation treatment, depending on the places that we're treating. So if it's in the breast, if we're treating on your skin or the anal section, the skin can open up like a bad sunburn, and you begin to see open skin, and that can be painful and sore. It can be painful and sore to the point that you don't want to continue treatment. This is usually how it goes. Dr. Melva, I've had enough. I'm not coming back anymore. You're beating a dead horse. I hurt like hell. It's not working. Okay? That's how it starts when you get to that point. So what we do is we have a lot of treatments, ways to treat that. But the best way to treat it is to begin with the end in mind, and that's the follow-up visit. So let's fast forward to that follow-up visit when you finish radiation treatment, anywhere from 6 to 8 weeks, depending on what's happening, maybe 2 weeks if you have a very rough skin reaction or moist desquamation, and you come back and it's gone. Your skin, thank you for that. And the skin has healed. The treatments that we've given you have worked. You can see the small wins that you've gotten during your cancer treatment, and you're on the other side. So you're beginning with the end in mind. So when I first meet my patients at the consult, the initial consult and workup, I like to talk about the follow-up visit, because that's where the gold is. That's when the painful areas that you had on your skin are gone. They've healed. And as your skin heals, your soul heals, right? So it's very, very important that you begin with the end in mind, because when you focus with the end in mind, it'll get you through. And when you know that you're going to get through, you're able to get through. Does that make sense? So I promised 3 tips. It's hard for me to keep count because I get really excited sharing these things, because I had a couple patients that came back today, and both of them pretty much told me, you know, the hell with these treatments. I'm done. It's rough. I'm not coming back. But you know what we did? We worked together to figure out how to have small wins. So number 2 reason to look forward to the follow-up visit is that you can count your small wins. A 2-week, a 6-week, an 8-week visit, you're going to have some small wins. And if you don't have the small wins you want, we still have time to get you there for the next follow-up. Okay, if you're just joining me, I'm Dr. Melva, your Board Certified Radiation Oncologist. Today, we're talking about the follow-up visit and beginning with the end in mind. Thank you for joining the broadcast. Please, if you're finding value, share the broadcast. Sharing is caring. So back to, thank you for that. So back to the points about the follow-up visit. So 1, the follow-up visit, if you've had a rough treatment course, whether it's a radiation burn or if you're going through chemotherapy treatment and you've been nauseous, you've had your blood counts drop down where you're going into the hospital, you've had complications from the treatment where you're not able to continue, you've had problems getting off work, continuing to work, whatever has gone through, the follow-up visit is what we're looking forward to, because it's one step closer to being done with your treatment. Okay? So follow-up visit, begin with the end in mind, so you're able to look to get there for the follow-up visit. Number 2, you're able to celebrate small wins. And number 3, every follow-up is a reason to celebrate. Okay, welcome to the broadcast. Katie, am I pronouncing it right? Welcome to the broadcast. Thank you for that. Welcome to the broadcast. So number 3 is that you're on your way to the next follow-up. Okay, a follow-up, you're a lot further than you were at the initial consult. So I appreciate everyone joining. Hey, Gabby, welcome to the broadcast. Thanks for joining the broadcast. Again, just to recap, and then I'll go through and read some of the comments. I appreciate everyone joining the broadcast today. I'm Dr. Melva, your Board Certified Radiation Oncologist, and I help patients that have been diagnosed with cancer through my community cancer centers, my videos and programs. I help them take charge of their life, navigate the cancer system, and live in spite of cancer. Today we went over 3 tips, maybe there were more, I'm not really good at this whole counting thing, of reasons why you should look forward to the follow-up visit. The follow-up visit represents having the end in mind, so getting you to that next point. Number 3 was celebrating small wins. And number 2 was that you were one step closer to the next follow-up visit. So let me go through and read some of the comments here. All right, Deborah says hello. Deborah says, yes, you're good. I was asking if you could see me. Tiffany says, hi. Hi, Tiffany. Tiffany says, I have 9 sessions left for my breast cancer out of 30. Yay! Oh, okay, I currently have what looks like a bad sunburn under my arm. Okay, Tiffany, so probably you're getting close to what I was talking about with the moist desquamation and the openings. What are you doing for that? How are they taking you through your care? Tiffany, if you're still on, let me know. I'm happy to answer that. Katie, am I pronouncing your name right? Is it Katie or Caddy? She says, you are the best, Dr. Melva. Hearts, prayers, 100. Thank you so much, Katie. All right, let's see. Katie, Dr. Melva, you should put some videos on YouTube. Hey, Katie, actually, I am on YouTube. I'm slowly uploading them. You can find me on @Dr. Melva. So it's Katie. I'm saying that right? Katie? Am I saying that right? So, Katie, you can find me on @Dr. Melva. That's spelled out DOCTOR, Melva, MELVA, on YouTube. I have a lot of my workout videos from last year on there. Okay, great. I'm saying her name right. Katie says, yes, I'm saying her name right. So now, thank you so much for joining the broadcast. I'd like to open it up. Are there any questions about what we talked about today with the follow-up visit? Any questions? Thank you for that. Thank you for that. Any questions for me about the follow-up visit, beginning with the end in mind? For those of you just joining me, if you're finding value, please share. Sharing is caring. Spread the knowledge as we arm one another with knowledge, answer questions. And Tiffany, if you're still on, I'm happy to answer your questions that you sent earlier. Let's see. All right. Any questions? Any questions for me? All right, well, while you do that, thank you so much for joining the live broadcast today. You can follow me on Facebook. I'll be back next Thursday at 6:30 p.m. Eastern. Until then, please follow me on Facebook, Dr. Melva, DOCTOR Melva. Thank you, friends. Bye. Oh, wait. Any book that you could recommend for cancer prevention, Katie says. So, Katie, let me work on that. There are a lot of different books out there. But I know you've asked me about that before, so I'm going to work on that for you and get some recommendations, okay? Sorry I don't have an answer for that now. I hope that's okay. But thank you. All right, bye. Hope that was helpful. The promise is good. I don't have it now, but I'll get it for you. All right, thank you for that. Bye, everybody.